Hi folks, welcome back. This is Kweko. I am a pharmacist. In today's video, I'm going to be reviewing the medication Sertraline, which is also sold under the brand name Zoloft. As usual, we're going to be taking a look at what it is used for, some side effects. We would also take a look at some 7 key precautions that I believe that anybody taking Zoloft or Sertraline should be familiar with. Before we go any deeper though, I just want to mention that my review is for informational purposes only, and it is not intended to be a substitute for medical advice from your physician. So please continue to follow any special directions that your doctor has given you with regards to your medication. Now with that out of the way, the question is, what is Sertraline or Zoloft? Well, Sertraline belongs to a class of medications called selective serotonin reuptake inhibitors. Now, serotonin is a neurotransmitter in the brain, and what it is that it is responsible for sending signals between nerve cells, and it plays a very significant role in our mood. The only problem is that once serotonin is released, what happens is that it acts for a relatively short period of time, after which it is taken back up into the neurons. So what medications like Zoloft and other SSRIs do is that they prevent this reuptake of serotonin back into the neurons. The effect is that the serotonin is available to act for a relatively longer period of time, leading to enhancement of mood. I must be honest that this is a very high-level explanation of the way Sertraline works, as the full mechanism is not 100% understood. I actually did another video which I'm going to link in the description. I'm going to put a card up there that you can check out, where I break down how actually Sertraline works. Now to the uses. The number one reason why Sertraline or Zoloft may be prescribed is in its use as an antidepressant. It is pretty much the most widely known use of Sertraline. It is also used in obsessive compulsive disorder, OCD as we call it, in panic disorders, as well as post-traumatic stress disorder, PTSD. Zoloft may also be prescribed for social phobia or social anxiety, which is a mental condition characterized by the intense fear that you're being watched or you're being judged by others. Sertraline is also approved for use in a condition called premenstrual dysphoric disorder, or PMDD. It is very similar to PMS, which most people are familiar with, but in this case, it tends to be a little more intense. It starts about a week or so before the period begins, and it's characterized by intense anxiety, depression, and irritability. Now, those are the FDA-approved uses. There are also what we call the off-label uses, which is situations where the medication may be used even though it has not necessarily been approved for that condition, but recent history and experience show that it is effective in those instances. And there's quite a host of them, and as you can see displayed on your screen right now. Feel free to pause the video and take a look at it if you want to do so. Now on to dosing and how to take. The particular dose would depend on what exact condition it is being used to treat. It is usually taken once a day though, even though in certain rare instances I've seen it given twice a day. But for the most part, it is once a day. Your doctor will typically start you on the lowest possible dose, or we call the minimum effective dose, and kind of work your way up gradually as and when you tolerate it. The thing about Zoloft and other antidepressants is that it may take about 1 to 4 weeks or so before you experience the full benefit. So do not stop taking it if you take it, say, 3, 4, 5 days and you think that you're not getting the desired effect. It may take as much as, even for some people, even as much as 6 weeks to get the maximum benefit. So keep going at it, and hopefully it would work for you. Now onto the side effects. And before I delve deeper into side effects, I just want to mention that yes, every medication has side effects. So usually you want to weigh the pros and cons, the benefits to risk. You do a benefit to risk analysis and decide whether it is right for you. The truth of the matter is also that untreated depression, it also has very serious consequences. So as you weigh the pros and cons on going on something like Sertraline, keep in mind, or have at the back of your mind also, that untreated depression also has its own negative connotations. With that said, here are the side effects, and I divided them into groups. The first group that I have is gastrointestinal side effects. That means the side effects that affect the gastrointestinal tract. And for those, you have things like constipation, which occurs in about 3 to 8%. We have diarrhea occurring, indigestion, and then nausea and vomiting. The next group of side effects are called the neurologic side effects, and they include dizziness occurring in about 6 to 17% of the population, headache, about 25% of the people, insomnia or somnolence, which is a strong desire to go to bed. So you see that it can affect you in either way. It can either make you sleepy or it can keep you up. Then there are tremors as well. Tremors also have been reported in about 5 to 10% of the people taking it. Now, there's also an interesting category of side effects, which I call the reproductive side effects. And it includes abnormal ejaculation occurring in about 7 to 19% of the people. For some people, it makes ejaculation difficult, or for some people, it actually completely makes ejaculation impossible. So that is something that you should have in mind. It may also lead to a reduced libido in up to 11% of the population that take it. And then also fatigue occurring in about 12% of the people, and excessive sweating, or what we call diaphoresis. This obviously is not a conclusive list. You may experience other things that are not necessarily listed here. So it's definitely a good idea that if you notice anything unusual while you start any new medication, to reach out to your doctor, discuss, and make sure that everything is okay. With that said also, it doesn't mean that anybody that takes Zoloft or Sertraline will experience any or all of these side effects. I have a lot of people that are taking Zoloft or Sertraline and they've been okay with it. It's handling their depression very well, and they've not gone through any of these side effects. This is just something for you to know, such that you know what to look out for, so that if it happens, then you will know how to react to it. Now, onto those 7 precautions that I talked about in the beginning. The first one is that Zoloft or Sertraline, and for that matter, all antidepressants, have been associated with worsening depression, and for some people, leading to suicidal ideation. There's actually what we call a black box warning for Sertraline to watch out for an increase in the risk of suicidal ideation. I must say that this typically happens in the younger population. Of course, adults it can also happen in adults, but it is more prone, or is more likely to happen in adolescents and teens. So if you have an adolescent or you have a teen taking Zoloft or Sertraline, make sure you're keeping an eye on such a person and making sure that everything is okay. They are not slipping into deeper depression. They are not having any suicidal tendencies. The next precaution is that SSRIs like Sertraline or Zoloft have the tendency to increase the risk for bleeding. So watch out if you're taking any other medications that also increase your risk for bleeding. So if you're taking aspirin, naproxen, ibuprofen, or even another blood thinner like a warfarin, Coumadin, you need to be careful. Watch out for any signs of bleeding, any bruising, just to make sure that nothing bad is going on. Sertraline or Zoloft have also been associated with glaucoma, a specific kind called angle closure glaucoma. So if you have a history of glaucoma or eye problems, it will not be a bad idea to let your doctor know before you start a medication like Zoloft or Sertraline. And also, while you take the medication, watch out for any changes in your eye, any swelling, any redness, any irritation that is not usual, and it would be a good idea definitely to bring that to the attention of your doctor. Another key thing to look out for is a condition called serotonin syndrome. Now, serotonin syndrome is a situation where there's so much serotonin in the system, and this can lead to very serious conditions. This can lead to an excessively raised blood pressure, an increased heart rate, increased sweating, irritability. All these are signs that there's a potential that you have too much serotonin in the system. This is aggravated if you take other medications that also cause serotonin to increase in your body. And off the top of my head, I can think of other antidepressants. So if you're taking 2 different antidepressants, or things like tramadol, I'll put a list of medications in the description that actually, when used concurrently with Sertraline or Zoloft, actually increase your risk of developing serotonin syndrome. It is rare, I must say, but it is worth noting, so you would know, like I always say, how to react if it happens. And the next one, alcohol. It's generally not recommended to take Sertraline concurrently with alcohol. It is also a good idea when you start taking Sertraline to at least take it in the first couple of doses in the home setting. Know how your body reacts to it. Don't engage in anything that requires you to be alert, driving a car, operating any kind of machinery, before you know how your body actually reacts to it. Then after that, then you can decide whether you are able to function normally when you take your Sertraline or when you take your Zoloft. Also, avoid abrupt discontinuation of Sertraline or Zoloft. Abrupt discontinuation may result in withdrawal symptoms, which can be very unpleasant. The best practice is that if you have to go off Zoloft or Sertraline, you need to be tapered over a period of time. So your dose will be gradually reduced over an extended period of time. And this is something that you and your doctor or your pharmacist can work it out, such that you don't fall into any withdrawal symptoms. It can be very unpleasant, I must say. So high level overview of Sertraline or Zoloft. I definitely hope you found some value in it. If you did, please give this video a thumbs up, subscribe to the channel if you have not already done so, and thank you so much for staying through. I will catch you on the next video. Thank you.